kwa etire a wo se ye kwa ye ni ma wo se etumi san ba ye ti ni ye behwe ye ya na tambia no obi wo ho a to bia ko secondary schools especially osi o na bosomi aso enti na wantumi anko class o na hu obi oba adwuma ba do adwuma no wadwa for no reason no wadwa obi ahoye na hi na ye nsem bebre enti na ehu nkomo ene ye ba betwetwe ye se Dymenorrhoea ye de ade da bia ye omo de ade no mama ne brofudin kakraka wo be boyi wa no kwa kofum e ma tamfo anyawo enso na ye behwe no kyekire mu na fe ye be kyekire asem bi e de amaye ne ate ase enu ntino ene oba pa Sylvia ene de oye de lady in yellow na wasan aba o brofo kakraka ya edi ka bo ya me pese me san bo bio because nipo tro brofo ma kakra because wo mo a want to me mo entino oba be cheche sansem ni nyina mama mo akwa aba looking good.
Thank you.
Shining. Mama said to so I bright.
Sir, I am Mississia.
Oh, sister.
Sister. Mrs.
Hey, sir. Also share yellow, so being so share yellow.
Sour. And I was sending Hunipa.
Oba pena na pe see Dymenorrhoea. Se brofo no sa na mo kan. Aha, e brofo kakraka wi. E ye den ade.
Brofo kakraka wi e che se oba wa ye bra.
Oh, ni nyina no no. Kakraka
pain. So it's a cramping pain you feel within your lower abdomen during menstruation.
Okay.
Inti say oba wa ye bra or koya obi mo. That is basically what we call Dymenorrhoea. Obabia, many women no, 1 to 2 days before or during the menses no, or koya obi mo. To some people, no pain way is just a discomfort. That is annoying. They can ignore it and then go about their normal duty. To others, no, it is just a severe pain that interacts with their normal activity. During this period, no be to me, say na wo kan on school, edwuma no wa, wo hu say no wa stre kwan na kyese ade no, eye ne ye pa. Nti saa ya oyi, ene ye friend Dymenorrhoea.
Any kind of menstrual pains?
Menstrual pains. We can simply say that menstrual pains.
But mommy, not just is it normal, so or baby, or so nyebi?
Oba bia ekosa ya we mu. Ebi mu wo ho a se na mekan no omo de no unhumpo say or ko bibi mu. But because we are different people, ebi mu ho omo threshold for pain varies. Obi so wo ho a ne hormone levels ni a lot of things contribute into. To obi wo ho a ne de no is or go through, but normally no obetumi akwa about aye ni activities normal. Obi so wo ho a on to me. There are causes to that lead to that. Dymenorrhea was primary Dymenorrhea, and menstrual pains were primary and they were secondary. Ufa primary 1 year, normal. You go through every month, and then no, it is not as a result of conditions that is affecting your reproductive organs. Okay. No, it is exaggerated. Exaggerated form, but a mild, a minimal.
Normal because there is a change in the system.
In the system, you feel. Into a bit more 1 to 2 days before or best start menstrual bleeding, no, na or who say on and pain, no. Then it peaks around 12 hours or by 24 hours, na ejai. Then you are free. That is the primary one. The secondary one is as a result of a condition that is affecting the reproductive organ. Into your conditions, we say endometriosis. And no, a uterine lining, no, I impede or implanted. It's implanted in other organs. Into baby to say fallopian tube, ovary, in your mind is a condition that is causing this secondary pain. Into no, no. Annoying. And no interrupt with whatever you do. You will be able to say adenomyosis. And also be able to say uterine fibroid. That no you can uterine fibroid once say a growth in the uterine wall. And also to me a cause pain way. I feel your infections via a pelvic inflammatory disease. It's as a result of sexually transmitted bacteria. Into say when you say infections CBA and also cause secondary dysmenorrhea. And I BB so to say a cervical stenosis. Into say we service baby amoja no befa APA no outlet no extra. It builds up pressure in the uterus. Into say pressure way Emma pain no eba. So send ayaka no we know it's as a result of a condition. But this one is just basic. The primary one basically is just because the uterus is contracting. And sana moja no beba no uterus no contracting to be able to expel the blood out. Into a contracted sana hormone be woha acting on the uterus and a causal uterus no. Emma no your friend prostaglandins. Sa hormones we producing more. It makes you feel the pain. And then when the uterus is also contracting, no, it is believed that it compresses on blood vessels. Into a compressing on blood vessels now, it impedes oxygen to other organs. So that one also causes pain during menstruation.
Something they also.
It also.
Yeah, sure. Obi okra na edu ne menses ni mu anase bia te say beba no otumi efefefefe ni ade nyina. Aside pains, are there some things that shows? And I say, on starting the menses, bibi o betumi show more who say, you might have this condition somewhere along the line.
Yeah, so aside the pain, no, ebi munya mood swings. Ebi mo ha obe vomit sa, obi benya diarrhea. Obi hu say obi very weak. Obi oye bibi kakra asena wa bre. Inti there's easily fatigability there. Obi so wo ha on to me any normal activity. So those are some of the signs that show, but all the signs no, it is not in the exaggerated form. No, just a fake a cry 1 or 2 days. Now we jai. Then the following days of your period, no, you'll be okay. Most of the time, no, best start here. Ebi mo ha omo de no utumi hu pa, but o start here, no, I okay.
Obi so ho do my calendar of.
Yes. Me no obi go school sir. Hey, Yanko Hospital la onwe.
Wow.
Yanko Hospital la onwe. This is Yakodu Hospital every other month.
Seriously. But in all kinds every other month you said no hospital, does it mean that it cannot be treated for you to go once?
It can be treated based on the course. And someone said those days no say you go school na yes sir. Inti ya no ye dey who say bibi na, but at least Oko hospital they know the course, so they are able to manage it. So it can be treated based on the course. Into say primary one, which is just contraction of the uterus now. When you see your doctor will be able to give you some analgesics. Na abuao senebeya ebema ya ono abafem. If it's as a result of PID, na you notice say we no na hawa ebema antibiotics bia and also be prevent it, and it will kill the infection and also eboa. If it's as a result of all this endometriosis, fibroid, and other things, then no say I will say you look at it and then tackle it with medication na ebeboa. Sometimes surgery even comes in. If there's a need for them to take out the fibroid for you to be free, they will do that. Primary one is say, and no, as you age, it disappears.
I was about asking that. Say ebe forever now. Primary one now can say normal one now, and when you as you are aging, it disappear.
As you are aging, it disappear.
But secondary one.
Secondary one, no, once the course is tackled, you are free. So I was say you near a course, send near course, then you'll be free. Even the primary ones, a lot of people are caught ABR, saying when you're netetis and not BBR or WOPE. If the person delivers, the person is free of the signs and symptoms.
Does it have anything to do with Nipano Ebiobia or dysmenorrhea? And I say menstrual pains or caught menopause? Will it have anything to do with Ebia what the person will go through during menopause?
If you should move linkage, besides say Ebia unya dysmenorrhea now was severe pains wo call menopause say menopause has its own symptoms say na ye be kan wo ha no but dysmenorrhea no just the pains that you go through abra wo youthful age by your niam bia predispose oba to these things. Normally you see oba onya early puberty 11 years and younger. Nature say obetumi experience dysmenorrhea obi a bleeding heavily and obi a onya intermittent bleeding obi a smoky obi a onum caffeine and obi a or less activities. Someone who is basically on activities or be so those are some of the things too that predisposes.
I read somewhere that you also clots. Maybe during the menses there are clots and things in the blood. And also no, is it because as a result of dysmenorrhea and I say and can just be because the person is bleeding profusely?
One time me can say service na no a building up pressure. Into sa moja ye was a flow say flow na ekoka we baby a to me clots. Clots no basically it's not baby heavier ba pom but you bleed and you see because when you are seeing heavier nature said there's another thing, another condition that is worrying you, but it can be a little clots that's also lead to pain. Some of them when catch us clots ninty. So in the management, basically, Dr. B and now way to me apply hot parts. Internet just a hot water bottle with the two lower abdomen and now with the two back. Those are some of the home remedies that you do that help with the pain.
Home remedies na who hear me because I believe say I can't remember when I was in school. Now there was this classmate of mine. Now on or bar on only they just say on para with hard liquid aquateshi. So of our bar school or bar with a bottle every month.
Seriously.
So on para with normal water. Still she will have problems until or the ebia hard liquor no ena. So what are some of the home remedies I say obi go through this pain? What they can hot water compression near there. What else can we do to relieve ourselves? So to
relieve yourself after this first remedy, which is the home hot parts, you can do regular exercise. So you just don't have to be at one place. You just have to be doing
exercise after, but during when the pain is there.
When the pain is there, all you need to do is to take a pain relief.
Okay.
Ask for pain relief for dysmenorrhea. It's over-the-counter drug. So something like P-more will help you. Something like Brufen. But to go all the way, nafa alcohol, and I don't see the scientific mean kind of baby. Say, won't say a fear dear, you were near my young Kasaya. It doesn't go with science.
And on Nanimoja, alcohol Nanimoja, and alcohol, no ben Nanimoja, no mina. 0244231707 0244231707 phone lines are activated into to me a friend. Now we beside you and also a special home remedy beer. Uni move to me at the word or the abani in I assume if we say you go so and I assume a dear and 0244231707 with me a friend. A WhatsApp number no so a 0207304356 me patch WhatsApp number no and ya call men fre o fry to me emfa na or WhatsApp and the be file 0207304356. Enti mama remedy ni egusua e ka ho asem painkillers no any hot water no apart from are there any other home remedies that we can use?
No, well personally I not advise that you should go and drink any concoction or take some alcohol because alcohol now will no. What's the effect? Alcohol rather will exaggerate your pain. I'm rather surprised say or no alcohol no need drona because when you are already in pain, what does it do? The effect say the man will feel disease say will be down so that she sleep order and now be
I think or on class in terms order. I have a caller on the line. Hello.
Yeah, hello.
Hello, good morning.
Good morning.
Me pacho your friend say o free.
If I share friend a queer, I free boy.
E ku am pacho ye ti o.
Make I show make a some bisa midwife ne say. Na go home so me menstruate for 3 weeks. Na back to fair Johnson. And mama me who say me say aka me say no say no dey sad never.
O menstruate for 3 weeks continuously.
If I try.
Na eba to say Johnson na say float profusely.
It float so the whole Johnson na.
And I still na clot assign wo mu.
Never try.
Is it a normal thing? And I say once 1 month be pen as 3 weeks ne buy.
Because the thing is me menses na stop boy. Into starting say ba no na basa.
Stop here at the wo ya now then stop here.
We can say me starting say me menses no. Month me in the following month in the guy.
Okay.
And after modern me call hospital until within a in the na fear. In terms last year.
Akuya.
She said about month 3 months na saba. E dane sa.
Oh, okay. Into month na beba no na aba for 3 weeks.
Yeah.
Wow. That's your bakery. Mommy.
Okay.
Osi oshase no.
A bar for 1 month.
A bar for 1 month in a jay.
No more than a cocoa hospitals near the
say who started women's afikra na obeye bra. It is normal. So we are the first one now. It will take some months before it comes. Then as time goes on, no, na regular. But say ubeka se moja etu for 2 continuous weeks. And then the blood is like a urine. Nenka was so to one meaning say a jai she should still go back and see her gynecologist because we bleed for first 7 days. After 7 days, we blood and kitten na echa. So after 10 days that you have stopped your menses, it's fine. But when it persists, 1 week, 2 weeks, 3 weeks, nature said there's something wrong. Why should you cry? I
said the menses, so I'm back every month. Into me who say me can say, and can I say about 3 months now? A babu 1 day.
Baby.
And yes, sir.
And sister say I'm back. One so shasi.
I have a caller on the line to William Pacho, my MP. Hello. Good morning.
Morning.
We Pacho from Soccer free.
Bajo mi di Ruby.
Oba Pacho free.
Gajo fi bubuas.
Ruby yetio.
Bajo ubisa nurse ni doctor ni say. Musu mo sa pain mu. Biya from bikini na ko pepa mo no ye from 3 years na started last month ni die na mutu kan ti ni ba pharmacy bi wo wona o ma mi sa do na ya di set no ina ma mi tam peki le bina na mi ye okay ka kan ti ni besides me so me ba enji clot every month be enji clot ba 1 month person bi say no man I say bibi o wana
oh yeah no how many years no ba no what say
oh me man say ben nya kwala ni
oh okay sorry but Mamines
we ache
until we ache how many years ni
almost 6 years ni
almost 6 years and after that no pain na sign aba pain o say pain signs by be 2 years ni ohun
bajai
okay Mamines
you asam me person me ka che no say we na jai nature say previous one was just the primary one that was worrying here and as I see I bet you say we have something like secondary one. And no it's as a result of conditions that is affecting your reproductive organ until was started now it is very painful severe one na onko hu ne gyne na yenye investigation na yenhwe say is it as a result of all this? Yes, so we kwa hu ne hu say enye we na ye we dan say we betna sia amanache no e be affecting. My advice is say obekwa report to hospital. Ni ahwe say den pa na eha no
na just say obi word dysmenorrhea na say owo it shouldn't and say after that no onya pain bia during the menses.
It's not like you shouldn't get a pain again, but it's something that it should be cool. You should just live with it. Oh, and yes, so severe. It shouldn't interfere with activity. Into say onya pain dia we are I mean we start to say we bleed dia. What say oh I say my say me kakra but enye pain na abra won ye.
Ebe ye o ya din for some be a seconds and have some minutes na ejai. E o mu kakra na wasan experience but yeah. I have a caller on the line. Hello. Hello. Hello, good morning.
Morning.
Me pa tell friends on ka free.
If I'm comfort in fifth bando.
Comfort in pa tell you too.
Okay. But you so my family plan is 2 years. Na me ko yi no me ye nurses na e ban so me tipe na e ban so I say cloth ni kakra o.
But your family plan ni ahi bi na ye
3 years ye ni be ba e di 2 years na me ko yi
3 years. Eno na mo de show mo nsa no ho. Okay. Enti ukoyi ye no na oye family plan na menses na e ba.
Na ban so e ba almost 2 weeks na ntwa. Nti amukwa na ma na dro na dai. Nti mi ye na saba.
Okay.
Na no so e ba na send ya ba 3 days na try. But so mi tip for me ase.
And a cloth nso wom.
Aye.
Okay. But before family planning no na about full 7 days but na say na fe about 3 days on.
And do 7 days, 5, 6 days.
Okay. Yeah, that's it. Mommy.
Family planning has a side effects and obi wo ha oya family planning ya onya prolonged bleeding. Obi so wo ha onya intermittent bleeding.
Okay.
So they all come in different forms.
All the types of family planning.
All the type of family planning. Ebia ni de obekomu. It's based on what you are experiencing. No, you have to go back and see your provider. Now I can't no. Nti bibi wo ho obeya most of the time there are remedies to it. Onso ka so koye ma omo ma na edro e na ejaye. But wakoyi family planning na echi no. Se moja no eba na se still heavy with pain she should still go back to the providers and tell them that oyi no say bibi wo ha ombeye wo ho amano. I
have another caller.
Hello,
good morning. Me pacha ya frost o ka se free. Oh, facha me pacha o call no me train. Me train o call no se beba. Ma me obi a owo menstrual pains pa no dysmenorrhea ankasa no. Does it have anything to do with the fertility of the person?
Okay, so dysmenorrhea itself will not cause you fertility problems. But so those are some of the complications. We are in medical complications for dysmenorrhea.
But Mary about humana so my peke no na yankasa. Hello.
Good morning.
Good morning, Mary. Me pacho eti say.
Mpacho, me question there. Me was 36 years. Me woda. Na what can me period no about 3 days. Me starting no about 3 days. Now, all depend there. Month do will change. Month go on finance about 26. Next month, born will be at 30th. The boy 31st. The boy 29th. No need be said the problem there.
Obapa me calculation na ya tire e ha. Kwanya ya fa so ya de calculate na we hu date ni ade because menses no ya ma ya nyante ase se enye se bi a 20 seat na eba na every month bi a 20 seat na we se eba. Who say month ni bi ho ya 30 days, month ni bi 31 days, month ni bi 28 days ni ade. Enti de mama me na esa kire ye nche how to count and know date na fe ye hu say problem bi wo ho ana say problem bi ani ho. Ye that's.
Yes, madam.
Bye-bye, mommy. But your counting the chemuyi. Because Nancy Krameka mentioned that Tiasi, Nancy and Nancy will chemunti. How do we count to know say we are in line?
So counting no, the easy thing for you to do is that sene we start moja sene why bra day 1. So mark it on your calendar. Say day 1. the next day is day 2. Day 3 till the next 28 days.
Until from and then we who mojano. What can you to the next 28 days?
The next 28 days, I was a fruit to me.
It's not date.
It's not date, because we are fit and now it doesn't mean that next month it should be fit. It will be more than 28 no cry when you count it like that.
Mommy, I have another caller. Hello. Hello.
Good morning.
Good morning. Oba Pampacha from South Free.
Pacho from Ministry, Mr. Festival.
Me Pacho is you, mommy.
And me Pacho, me person in this one say. Now I was on the investor, the 3 months one. And I'm a guy. But I'm not for 4 months in a minute, so I want to know if there's something to be done to bring back my fertility system.
Me Pacho, what your injection now menses no na eba.
No, but not as the normal one.
Uja, how long near? 4
months.
4 months near. And I say on but we 4 months in say number. Okay. Yeah, that's it. Mommy. And I said the assessor the adrenaline effect no system in one number.
Our system, there's a school of thought that says that we are hormonals we now we a slim person now. It's worse off easily. And now we will be aware plumbia a check a cry. That's a school of thought that says. But 4 months is too early for her to have issues with fertility.
Okay.
And see, so Oshena say at the end of so hiano bebrea and the may recommend this say obekwa kohune gaini. Ohune gainia ono na obeye nhwehwemu ahwe bibi poten asemboa bi wo ha or was the buana or the bebuano ma ehu obi mbono. She should rather just go to the hospital and go and report.
But under normal circumstances, 4 months is too early.
It's too early.
For the
and most of the time too, when you are eager, when you fixed your mind on it like that, ain't relax. Yeah, relax. Or relax. Although you not dream to baby. Oh, so I was fixing our dream to say, my family planning. Say no.
Say. Pacho, my man picking me last caller na. Yeah, baby. Hello. Hello. Good morning. Doctors, me pacho ma wano so kakra na yentumi nti asema.
Me kasa
okay.
Pacho, me family planning me wo 3 months be anything. Na me wo ye no me next sema. Me beto me di enti ma. Na me pray.
Oba pa ya te Nyankopon hira. Asem we me ka me wo ho answer but nurse wa head mama nurse ma ho answer because me so mabisa e me ye kirekire me muntu do oba pa.
Say so those are some of the things. It's either emba for some time. Ebi wo how be ya prolonged bleeding, ebi wo how be ya intermittent bleeding. Enti man worry. Onko back to the provider. No onko ka che ni say since I obey family planning moja no ebi ntu no kra say or bibi wo how obey ma no if it's counseling or whatever they will take her through the session.
Okay.
She'll be fine.
Big question I say I want to know what to do about pains. I mean severe pains during the period. Okay, say be not when chassis empty or so who say severe pains during the period na then onye. Mama na say the kan ma yati ase say wunya sa hot water containers be abetumi dey atoto say hot water ni be container ni be kra ni watumi the towel. Ofo oya towel no warm kakra dey atoto to kakra betumi so anya painkillers be dey afa. Say yes answer na so na say beyond severe there then you have to go to the hospital and see a gynecologist. Say there might be an underlying problems ewo ho. Mama your time na so but menstruation counting no ma mention say me understand and if it's what you said was it Thursday na be humoja no we count it from that day now till the 28th day now the next one should come enye da na wo be wie no na dey be count
baby enye da na wo be da na wo be humoja
da na wo be humoja say ade na enye fix say me dey first bia na eba nti o say first bia na eba per your counting no and a lecture date.
If it comes first, it should be the next 28th or 29th or September.
I say 1 month, and I say, Kaya, you should have 1 month, the Hunimiu, but per when there 28 days intervals.
Yeah.
I said, we are that's the part my men said they won't church. A question you on our Hanaka is the same beside me, Miss Audio to me, and the affair WhatsApp. No, so next week about maybe obey ye questions in our WhatsApp number near 0207304356. Obey to me, Edo questions now for meaning say phone calls and still anchor for every change. To be there for message, Ebra WhatsApp message, Ebra WhatsApp, no, your budget na. Now what you send oba no be yi ni nyina ano e de amount aseda ene de mo bibi oboy ya chidom bia technical team ni nyina obi a nyankopon enhira mu nyina me executive producer so nyankopon enhira me di ene abena ofa bia ukuada na pa odom fodom ye no to nso pa bigu ye so e be san ehia bio bye bye.